Hello and welcome to the Yoga Therapy Toolbox, and this week it's going to be a recording instead of an email in your inbox. And this Yoga Therapy Toolbox is very relevant to something that has happened to one of my clients, a very, very young girl. And this Yoga Therapy Toolbox is about critical thinking. Now, we want to have critical thinking as yoga therapists, of course, and we want to think outside of the box, but without taking it to the extreme. But I will share with you what happened last week with a young girl. She's 24 years old, and she has pain all over her body, but particularly in the sacrum area and the spine and the muscles around the spine, but also as well around the elbows and the wrists and the knees. Now, whenever you have a client who has joint pain in several joints, and particularly if they're symmetric, further investigation needs to be done. And so she went to hospital, and she was under the care of a rheumatologist. And I was waiting for news. I worked with her already once, and I said, okay, the whole body is very, very tight, very painful joints. Also, the muscles are really tight. So I was very happy and very pleased that she was going to hospital to have a full screening. So when she came back to me after this, she said to me, Montserrat, I've been told after the tests that I had yesterday, blood tests and also CT scans of the sacrum and the spine, that I probably have fibromyalgia and that I will have to live with this for the rest of my life. So my questions to her were, only 24 years old. And I said to her, well, did you get the results from the blood tests? And did you get the results of the CT scans? How could the rheumatologist actually be able to give a 24-year-old a diagnosis of fibromyalgia after 24 hours and without having ruled out other problems? So she came back to me and said, no, we don't have the results yet. The results are not here for another 2 weeks. So this rheumatologist in a hospital in Amsterdam had told a 24-year-old girl who's aching all over that it was most possibly fibromyalgia, and that she will be suffering from this and having to cope with this chronic pain condition for the rest of her life, without having received the results of the CT scan and no the blood test yet. Now, this was highly irresponsible of this physician, and of course, what to do as a yoga therapist in this case. First of all, this is outside of my scope of practice, so naturally what I want to receive is a diagnosis from the doctor so that I know how to work and what to do, and particularly what not to do with this client, very young client, who is practically paralyzed physically and emotionally from fear of what this could be. And then she receives this information from a specialist who's decided to say this to a 24-year-old. It really is quite a scary situation. So as a yoga therapist, what can you do when this happens? Something like this happens, when you realize that maybe a medical professional is not acting ethically, they're not acting professionally, and that further testing needs to be done, you need to wait for the results and so on. So number one, I'm going to work with my client as they are and with what they bring onto the studio, onto the mat. So it doesn't matter what the results are, I have to take care of my client with the symptoms that she's presenting. And I'm very careful with that. I don't make my own opinion on what she has or she doesn't have, because that's absolutely beyond my knowledge. And so therefore she comes to me with very tired muscles, very tight joints, a lot of achy movements, exhausted, a little bit of foggy mind, a little bit dizzy and tired, exhausted, very, very anxious, because she naturally thinks that there's something seriously wrong. And now she's been told that she has this condition which is going to last for a lifetime. So that is what I'm going to work with. Okay, so regardless of what the results of the test are. Number two, I do encourage my client to chase those results and to say, okay, well, she's 24 years old, so I did ask her to involve her parents, which actually her parents are quite involved in her life. So in this case, it's not a problem. And I said, do involve your parents and see if you can put pressure on your doctor to get your results and to receive those results, that you have a very clear diagnosis. Number three, you can always encourage your student or your client to look for a second opinion. So I make no comments about what the medical professional says or doesn't do, because it is beyond my scope of practice. However, in some cases, I always do recommend to have a second opinion and to say, hey, before you receive a lifelong diagnosis, when you're only 24 years old, do get a second opinion. And not only when you're 24 years old. Yeah. So that is something that we can do within our scope of practice without interfering with the medical system. Now, I am absolutely not against the medical system. My God, it's, right now I'm going through personal circumstances where, with a member of my family, I don't know what we would do without the medical system. They're literally lifesavers. However, like any other system, it can fail, it can have flaws, and it needs following up, and it's never right. We mustn't put it on a pedestal and say everything that they do is perfect. Of course not, especially nowadays when doctors are really taxed and really tired, overworked and overwhelmed with too many patients that they just cannot handle. But what we can do is work around it and work with the client with the symptoms that they have, as I said, very carefully. Always better to work from the lower levels, and then we can always build up. And then recommend them to chase up those results, to do further testing, and to ask for a second opinion if necessary. Now, that diagnosis, when it arrives, is going to be very helpful for my work. It's not the same working with somebody with fibromyalgia than with ankylosing spondylitis, which could be one of the things as well that are on the cards for this person. Whether it could be an autoimmune disease, also a possibility. My work is going to be very different if the diagnosis is one thing or is another. So it is important that that diagnosis is made, that they come with it. But in the meantime, if for whatever reason the diagnosis is not possible, let's not forget that some disorders, they take a long time to be diagnosed and they need further testing. In that case, I continue to work with my client with whatever symptoms they are presenting and working with them as a whole human being who is actually not only experiencing those symptoms, but also the anxiety from not knowing what is going on at the moment. I hope that you've enjoyed this. This comes from a real case that I've had last weekend, and so I hope that, I hope that you enjoyed this yoga therapy toolbox, critical thinking, asking questions, and always working within your scope of practice, but making sure that you encourage your clients and students to look further into their own diagnosis and their own health. Thank you, and I'll see you soon.